The Ontario Medical Association is raising the alarm over the working conditions of family doctors and warning many could leave their practices if the issues aren't addressed. Early this week, a prominent family doctor in Ottawa announced he was burnt out and leaving the practice. This led to other family doctors coming forward with their own issues, including stress, mountains of paperwork, and pay not keeping up with inflation. The situation so bad, the Ontario College of Family Physicians says 1 in 4 people in Ontario could be without a family doctor within just 2 years. For more on why we're seeing an exodus of doctors from family medicine, we're joined by Dr. Andrew Park. He's the president of the Ontario Medical Association. Thanks for joining us today.
Thanks for having me.
Your organization is warning family medicine is a failed business model as it exists in Ontario. What do you mean by that?
Well, what a lot of people may not realize is that family doctors own a business, and they're reliant on the incoming billings as well as the patients and the flow of the ability to provide care. And what we've seen is that through record levels of inflation, as well as our funding that's only gone up by 1% or 0% versus 4 to 8% inflation, it just doesn't work as a business model anymore.
So the situation on the ground as it stands, what are you hearing from your colleagues in family medicine about what the struggle is, why they're leaving their practices?
So it's twofold, as you mentioned on the top about the Ottawa physician who's left his practice. Unfortunately, I'm hearing hundreds of stories of this from my family doctor colleagues. That is not uncommon. And it comes down to two things. Number one, we talk about the business perspective of running a practice, but also the inefficiencies, the inefficiencies of running a practice because of the numerous bottlenecks that are created by administrative burden in family medicine. Just make it so that it's both unattractive as well as you really can't do what we signed up to do, and that's to take care of patients.
Now, growing up, I think, myself and probably most people were told, become a doctor because you're going to make a lot of money. But this isn't what you're hearing, and this isn't what the reality is from what we're hearing when it comes to why doctors are leaving the practice. Can you break that down for us, why this is not a good business model?
Yeah, I understand that public perception, and we've heard that numerous times. But as a family doctor, your gross billings minus your overhead costs are about 40%. Again, when you apply inflation to 40%, that's a massive income hit. And when family doctors, who are the foundation of our system, do have options to go, for example, hospital-based practice where they're not paying that overhead, that's where you're seeing a big exodus of family doctors.
Okay, so what can be done then? What are the solutions that you're proposing here?
So twofold. Funding does come into this conversation. Absolutely. That's very important. I do think it's important that as physicians, we have infrastructure support, whether that's support from the government for teams, administrative support, to take the things off the plate of the doctor as a business owner and really gain that focus back into patient care that we all went to medical school to do. So we're calling for team-based care to be improved across the province, which we've seen some momentum on, and we're pleased to see that. But we're also calling for a reduction of administrative burden for things like referrals, a central referral system, AI, artificial intelligence scribes. So we have a lot of solutions, and we are working with government to implement.
The government has announced a $110 million investment to create 53 new primary care teams. The federal government following up with $3.1 billion agreement with Ontario to hire more doctors, more nurses. How much is this going to help, do you think?
I mean, it's going to help. Anytime we're getting funding into the system, it's going to help. The concern that we have is that we are approaching a demographic curve in our population where our patients are going to be much more complex. So that help is much needed. But the other problem, though, is that up to 2/3 of physicians, particularly in family medicine, are looking at either reducing, retiring, or changing their scope. So we're hitting a bit of a perfect storm. So this funding is much needed, and it is a good start. But there's going to be a need for increased funding in the near future as well.
You know, and we're also hearing 1 in 4 Ontario residents could be without a family doctor, as we say, by 2026. Is there a way to change this, to turn the tide here? Or, you know, is the push from this demographic shift, as you were explaining there, is this just going to be, you know, the way it's going to roll out as it will?
No, I don't think so. I think there is a real opportunity to make a difference here. The greatest opportunity is in the workforce that currently exists. Certainly, training more family doctors, hiring more family doctors from abroad, that is going to have some impact. But the greatest impact is going to be for those physicians who decide to stay in practice, and that's going to come through again, as I talked about, those things where they're supported in their practice to actually see patients and not have 20 hours, up to 20 hours of administrative work per week, which is 2 full days of seeing patients. They're doing that in their off times and in their evenings and weekends, just because they can't keep up. So we really need to make practicing family medicine a viable option again.
Well, thanks for explaining the reality on the ground as your colleagues are seeing it there. Dr. Andrew Park, president of the Ontario Medical Association.